Well, thanks for having me. My name's Owen Stormo. I'm an ER physician of long standing here at Santa Barbara Cottage Hospital. And about 20 years ago, I realized that a lot of the disease we see in the ER is perfectly preventable, and started looking into ways to go into the wellness business instead. It turns out it's kind of tricky to do such a thing, but over the last 7 years, my wife and I opened up a bioidentical hormone replacement program here in Santa Barbara. Well, the question of whether hormone therapy causes breast cancer is a big question. That's top item on most women's question list when they come to talk about hormones. The problem is that there's significant confusion. Way back in the 70s and 80s, doctors started using hormone replacement therapy to help women through menopause and found that it lowered the risk of a heart attack, of death, of stroke, and lots of good things. So they started using hormone replacement therapy very liberally. It was when the World Health Initiative study came out in 2002 that threw this whole question into confusion. Unfortunately, the World Health Initiative study used synthetic hormones, and it's clear that those hormones cause or raise the risk of breast cancer for women who are taking them. So the better part of the question is, do the bioidenticals do the same thing, or are they different? If we stick to hormones that are exactly the same as when you were younger, do they cause cancer? And the answer really seems to be no. So from a non-hormonal treatment point of view, there are things a woman can do to lower her risk of breast cancer going forward. Just by being a woman, you have a risk of breast cancer, and unfortunately, that's about 1 in 8 women has a brush with breast cancer. There are a number of things about the risk of breast cancer that you can't control. For example, your breast cancer risk goes up after age 50. You can't control how you age. Your breast cancer risk goes up if you happen to have started having menstrual periods before age 12 or don't go into menopause until after 55. Again, that's not something that you can do much about. You can't do much about your genetics. You are who you are. You can't pick your parents, and so your risk can go up. If breast cancer runs in your family, you have a higher risk. The things you can do, however, it's very clear that if you're physically active, you have a lower risk of breast cancer, so get out and move. If you're obese, you have a high risk of breast cancer as well, so try to maintain a normal weight for your height. Staying away from the synthetic hormones clearly will keep your risk down at the normal level and not increase your risk of breast cancer, and I mean the synthetic hormones. Another risk factor that increases your risk of breast cancer is too much alcohol consumption, smoking, not breastfeeding when you did have the opportunity. And there are some dietary things you can do, like eat high fiber foods, lots of fruits and vegetables, and avoid the bad kinds of fats. One of the interesting facts about hormone therapy in general is that you cannot patent a naturally occurring substance. So estradiol, as it occurs in nature and in women's bodies, testosterone that occurs in nature and in men's and women's bodies, and progesterone cannot be patented. Like you cannot patent honey. But if you develop a process to make honey, you can patent that. In the chemical world, the drug manufacturers would much rather design and develop a drug that is new, and they can patent it because it makes them a lot of money. They can't patent estradiol, for example, and sell it for anything more because it's universally available and any drug maker can make it. Bavera, for example, was designed to help women through menopause symptoms, and it worked extremely well. But 20 years later, it was found that, oops, it happens to raise a woman's risk for breast cancer. So the profit motive of making billion-dollar-a-year pills is good for the drug companies, but down the line, it sometimes turns out to be a bad idea for the women. Estradiol is what you were given at age 12 or 13 when you started going to puberty, doesn't cause the breast cancer risk. Synthetic hormones can, and that's the biggest thing to understand. Regarding bioidenticals versus synthetic hormones, first of all, the most important thing to understand is that bioidenticals mean they're exactly the same hormone that you have in your body. Synthetics basically means it's a hormone that's similar to that, and it was created because it has the actions that the designers want to have, but it's not exactly the same hormone that you were born with or developed in puberty. This is a diagram of the hormones that we're talking about, and as you can see from the diagram that the cells that make hormones come from cholesterol molecules. Cholesterol is brought into the cell, and every numbered spot on this diagram is a carbon atom. And it draws into cholesterol into the cell and lops off this little tail, and you're left with a 4-ring structure that is the first pre-hormone called pregnenolone. The body then converts pregnenolone to progesterone, which is right here, and if you keep going this direction, you'll find cortisol, which most people have heard of as a stress hormone. Aldosterone is a blood pressure support hormone. If you go down this way, your body is lopping off more and more of the carbon atoms, and so testosterone is way down here. Testosterone is metabolized to estradiol here, and estradiol is further metabolized. Here's estrone and estriol. This is E1 and that's E3. Estradiol, the di meaning 2, is often called E2 and is right here. So all 3 of these are naturally occurring bioidentical hormones in your body, but 90% of the action of the hormones is all in estradiol. So I prefer just to give estradiol directly because it's an inexpensive pill or a cream a woman can take, and the body will make estrone and estriol from that. Estradiol does 90% of the functions of estrogen for women, and that's many, many things. It has to do with your menstrual cycle and ovulating and supporting a new fetus in a uterus. It also has a lot to do with breast engorgement and making of milk down the road. It's also very important for mental health. Turns out estrogen is what keeps your brain cells healthy and gets rid of the beta amyloid buildup that causes dementia, specifically Alzheimer's dementia. Estradiol is also very important for bone health and prevents bone mineral density loss as you age. In fact, the only drug known to man that helps a woman put bone mineral density back into her bones is estradiol. All of the other osteoporosis drugs just start to limit the loss, but estradiol actually builds bone density back into your bone. Here's the molecular structure of testosterone and estradiol, and if you look carefully, you'll see their only difference is a single carbon atom right here where this little line ends. That is lopped off to make estradiol, so the difference between testosterone and estradiol is a single carbon atom. That's not a very big difference. Testosterone gives you that, and estradiol gives you that. Big differences in outcomes. Now, of course, this has a lot to do with your genetics and a Y chromosome versus 2 X's, and there's a lot of other factors, but a single carbon atom makes a very big difference in hormones. This is natural progesterone. This is what it looks like in your body. At the time Provera was created, it was designed to help a woman through the symptoms of menopause, and it worked really well. Unfortunately, it has 3 more carbon atoms, 2 extra oxygens, and 6 extra hydrogen atoms, and that difference, while it made a woman feel better, is what led to increased risk of breast cancer. It's markedly different from progesterone, more so than estradiol is different from testosterone. And that marked difference, while it made this drug more readily absorbable, made a great pill for women to take, it also led to an increased risk of breast cancer. So we don't use medroxyprogesterone acetate because that's a synthetic hormone. See how it's different than the bioidentical. I think the issue about physicians not understanding the difference between the synthetics and the bioidenticals is largely a matter of education. As I said a moment ago, the big drug makers try to make blockbuster pills that can make them a lot of money, and then they're out pushing their own products to physicians. So physicians hear the education from these drug makers that this pill does this, it's great, it has a very minor side effect profile, etc. But that's only in their early testing. Testing whether it causes breast cancer can take years and years to figure out. And so they market their own products, telling the doctors that this is better than natural progesterone. There's no difference really, but if there is, this is better. And that's just not true. Doctors get a lot of their education from the new breakthroughs in medicine, whether it's a new drug or a new procedure or surgery they can do or a new medical device that they can use. They do get their education from the people that make those. They, however, are not unbiased at that level. My feeling is that Mother Nature gave you two hormones that work really well, so if we can use bioidentical hormones, we should. Certainly estradiol and progesterone didn't do you any harm when you were in your 30s. I think giving it back to you when you lose it in menopause makes much more sense than substituting a synthetic hormone. It was found back in the 1950s by a very enterprising pharmacist that he could make progesterone from a root of a non-edible yam found in Mexico. That chemical is called diosgenin. It's here pictured. This is a hormone-like substance with the same four-ring structure but a different tail up here. And chemically, he could isolate diosgenin in large vats from the yam plant, and then chemically treat it such that it would turn from diosgenin into progesterone. Subsequently, they also found that they could create estradiol and testosterone from the same molecule. The bioidenticals are made from this chemical, which is a naturally occurring substance in both yams and soy. These chemicals, once they're made into progesterone, can then be made into all the other bioidentical hormones, testosterone and estradiol, and they are then given to patients in the bioidentical form. So while there is some synthesis happening, its root is a natural root in that it comes from the root of a plant. It's synthesized into the bioidenticals. That's where the words synthesized and natural get a little confusing. I am frequently asked whether eating soy and yams or putting soy-based creams or yam-based creams on my skin will increase my estradiol level, and the answer is no. In the chemistry lab, we can convert diosgenin, which is a product of soy and yams, into this thing, but your body does not have the correct enzymes to do that. The big question and the confusion about whether hormone therapy actually causes breast cancer is still not fully solved. A lot of the articles that say hormone therapy causes an increased risk of breast cancer use synthetic progesterone, and they used estrogens from horse urine. These studies were done a long time ago, so we're still trying to sort it out. Newer studies using bioidentical hormones have shown that bioidentical estrogen and progesterone actually lower a woman's risk of breast cancer. The largest of these was a French study that included 80,000 women. They broke it into 4 different segments. The top segment used nothing whatsoever at all, had no hormone therapy. The second segment had estradiol and progestin, a synthetic progestin. The third category had estradiol alone, and the last one had estradiol and progesterone, bioidenticals, both of them. And the estradiol with progestin compared to the background of no therapy increased a woman's chance of breast cancer by 60%. The estradiol alone increased a woman's risk of breast cancer by about 20%. In the final group, with being treated with estradiol that was bioidentical and progesterone that was bioidentical, that group had 0 breast cancer above the baseline control group. No additional risk of breast cancer using those 2 bioidentical hormones. And that group comprised 20% of that 80,000 women, and that's a large number of women. That's the best study to date that shows the bioidentical combination does not raise a woman's risk of breast cancer. The question about whether a woman who's had breast cancer can ever take bioidentical hormones again in the future is a very tough question. It's under a lot of scrutiny right now. It's turning out that the lack of estrogen causes so many other problems, such as heart attacks and strokes and dementia, that from a quality of life standpoint and a survival standpoint, you probably are safer to go ahead and take estradiol after breast cancer than you are to not take estradiol. Now, at what point can you restart it? The current trend right now is that about 5 years, if you're still cancer-free, you can consider going back on your hormones for the other risk reduction purposes and just to feel better. There are some places that are using a little progesterone early on when they can't use estradiol, and that seems to help women's symptoms. And there are some places using some testosterone. But the final answer to that question is still not known. So any woman that has a history of breast cancer or even a strong family history should talk to their own doctor about it who does hormones for a living and involve an oncologist if they've had cancer in the past. And between the three of you, you can come up with a plan that's often quite satisfying. I have at least 3 clients who are past treatment for breast cancer that are using hormones successfully right now.